How would you describe the bones of this agreement?
Well, I think it's a very positive day for NHS patients and actually for doctors as well. From the government's point of view, we've got all the red lines that we needed to improve weekend care. The extra cost of employing another doctor at the weekends will fall by about a third under this agreement, which will make it much easier for hospitals to improve care at weekends. We're basically moving to a system where it's in return for a pay rise, it's agreed that doctors will work a certain number of weekends a year at no extra charge. But I think we also have to reflect that this has been a very bitter dispute. There are lessons to be learned on all sides. I think there was a message in the industrial action that unfortunately took place, that there was a lot of unhappiness amongst junior doctors about things that weren't necessarily to do with their contract, to do with the way their training operates, to do with the quality of life in those very, very tough jobs. And we want to engage positively and constructively to address those issues because they are the backbone of the NHS. And, you know, I do pay tribute to the leader of the junior doctors, Johan Malawana, for having the courage to negotiate on weekend pay, which is something the BMA haven't been prepared to do previously and has made this deal possible.
Well, that's there's a lot of interesting content in that answer, Mr. Hunt. Thanks very much for setting up quite a few things there. Can I pick you up on a couple of them? First of all, this is the tough question to ask. Who's given way here? Because frankly, there was no agreement, or there was very little agreement when you were approaching this weekend roster. The fact that you were wanting to overall to have a smaller bill to pay, that's the bottom line, isn't it? So what happened in order to make this agreement possible?
Well, I don't want to talk about winners and losers, Hugh. I hope you understand. I mean, we've got everything we needed for a 7-day NHS, and at least as far as the junior doctors contract, part of that is concerned. But we've also made some concessions around the way that maternity is done, around more flexibility in rostering, things that I know matter to junior doctors that I think make this agreement possible. And I think what this really shows is that if we sit around the table and talk about issues that can make care safer for patients and improve the working conditions for doctors, you can have a win-win, and I prefer to characterise it that way.
OK, well, you've mentioned there are lessons to be learnt on both sides. Let's explore that then. And can I ask you to give us an open answer to this one? What would you do differently in the way that you handle this? If this was starting now, that you know now, what you do know, how would you do things differently? Would you?
Well, it's very difficult because we have a manifesto commitment to a 7-day NHS that we absolutely must deliver to the British people, having been elected a year ago to do that. But I think what we didn't understand at the start of this process was the amount of discontent amongst junior doctors about things that were not always to do with the contract, about the fact that, you know, you could be a junior doctor who's posted to Leeds and your partner is in London, and it's very, very bad for family life if you're apart for 6 months. And there are lots of frustrations like that, which I think came to a surface through the industrial action that we've seen. And I think that this agreement that we now have, which has the support of the junior doctors leader, he's going to be encouraging his own members to vote for it, gives us a chance to address some of those issues, but there'll be other issues as well that we can look at and value the role of junior doctors in the NHS, and I want to take the opportunity to do that.
But forgive me for pressing, Mr. Hunt. I'm just asking, you know, are you saying that you have no regrets about the way you've handled this dispute?
Well, I think the way to put this is, you know, we have to implement manifesto commitments. I could be critical of the fact that there was a very long period of time when the BMA were refusing to talk at all. But I think the point is that on both sides we've learnt through the process of the last 10 days that actually talking works much better and that it is possible to end with a win-win. And we can deliver our manifesto commitment for a 7-day NHS, but also make real progress in addressing some of the concerns that junior doctors have had about their working conditions, and that dialogue is the way to achieve these things. So I think it has been a very positive week.
When will this new structure be in place and up and running?
Well, we have to now have a vote by junior doctors who will want to consider very carefully what is the biggest change in junior doctor contract conditions for 17 years. It's a very, very big change, and they'll want to consider it carefully. But the agreement talks about the new contract being implemented from October this year and about a 12-month period before all junior doctors are put onto the new terms and conditions.